Okay, so for this video, we're going to actually look at just the anterior forearm musculature. We're going to start by identifying a couple of the muscles that are on the anterior side, and then we'll come back to it and just assign the different functions that are associated with those muscles. So if you notice, the cadaver is facing up. We have the cadaver in a supinated position, and from here you'll be able to see a nice picture of all the anterior musculature. So I'm going to go ahead and just move some of these vasculatures out of the way, right? And then we can see a nice picture of all the muscles. Right now, if we follow majority of these muscles on the superficial layer, we can see that they're kind of originating from this medial epicondyle of the humerus, right? That's going to be the bony prominence on the humerus that is easily palpable, and you can see a lot of these muscles are going to be originating from here. So we're going to say generally that these muscles on the superficial aspect, which I'll mention, they're going to cross the elbow joint. So ideally speaking, when you think about functions related to these muscles, you're going to have some kind of flexion of the forearm at the elbow. So just keep that in mind going forward. So we'll go ahead and start by identifying a couple of the muscles. So I mentioned that much of these muscles are going to start on the medial epicondyle. The first one that we're going to look at is actually going to start on the lateral aspect of the humerus, and that is going to be this muscle right here. Right? Sorry. We're going to be looking at this muscle right here. Right? Notice if we follow it, it's going to be starting on the lateral aspect of the humerus. This is going to be brachioradialis. And then the next four superficial muscles that we'll see is going to start on the medial epicondyle of the humerus. And what I want you to do when you're looking at these muscles, what I want you to do is take your thumb, place it on the medial epicondyle of the humerus, spread out your fingers out this way, and then you're going to go pass, fail, and that's going to clue you into what the names of these muscles are. So pass, fail, right, is going to be pronator teres, flexor carpi radialis, palmaris longus, and then flexor carpi ulnaris. So let's go ahead and identify those here. Right, again, we had brachioradialis. Now we're going from the medial epicondyle of the humerus, and you're going to see this muscle right here. Notice how that's going across this way, and that's attaching right on the radius. So that is going to be pronator teres right here, starting, and you can see it follow it down. Pronator teres. Now if we go left again, or more medial, we're going to see flexor carpi radialis. Still superficial. We go a little bit more medial, you're going to see palmaris longus. And then let's follow it out a little bit more distally, and you can see how palmaris longus is going to attach to this soft tissue right here. That's going to be your palmar aponeurosis right here. And then the last one is going to be right here. That's going to be your flexor carpi ulnaris.
Twist the hand like before more. Yeah.
Alright, so again, flexor carpi ulnaris. So just from the top again, right, we got brachioradialis, pronator teres, flexor carpi radialis, thumb side, palmaris longus, attaching to this palmar aponeurosis, and then again, the last one over here is going to be your flexor carpi ulnaris. Okay, so those are going to be your superficial muscles. The next three are going to be your intermediate muscles. So what I'm going to do is I'm just going to go ahead and flex the hand a little bit, just so these muscles loosen up, right? So you had palmaris longus. I'm going to go ahead and move that out of the way. And we can see this muscle right here, a couple of tendons going. This is going to be flexor digitorum superficialis, right? Just from the name, you can tell that because it's flexor digitorum superficialis, there's going to be another muscle that's going to be deeper to that. So right here you can see again the tendons. Flexor digitorum profundus. Profound meaning deep, which is going to be right below flexor digitorum superficialis. and then flexor digitorum profundus. What you want to note about these two is that flexor digitorum superficialis is going to also start at medial epicondyle of the humerus, with the exception of flexor digitorum profundus, which is going to actually start on the radius and ulna, and the tendons are actually of this flexor digitorum profundus is going to go all the way out to the proximal phalanx, and then, sorry, the distal phalanx, and then flexor digitorum superficialis, this is going to go, the tendons are going to reach all the way to the middle phalanx. And usually we would have a nice picture of the tendons here. We don't have that dissected, otherwise I would show you.
Could you show the difference between the middle and the distal phalanx?
Mm-hmm. So if you see where the skin is still intact, right, that's going to be your distal phalanx, right? So that's going to be flexor digitorum profundus. It's going to go all the way up to this, and we'll talk about the functions later, so it'll make sense. And then flexor digitorum superficialis is going to attach to the base of the middle phalanx right here. Okay, so the other one that we want to see is going to be, so I'm going to go ahead and flex it. So we identified this one, right? Flexor digitorum superficialis, flexor digitorum profundus. And then now if I go ahead and move it to the side, you can see another one in this intermediate level right here, the tendon. And notice when I pull on the tendon, if you look at the thumb, it's going to go ahead and move, right? So this one is going to be flexor pollicus longus. So any of the muscles that are going to the thumb is going to have the name pollex. And then again, as we mentioned previously, these are going to be the digits 2 through 5. So just to show you that again, right here, more medially is going to be flexor digitorum superficialis. Right underneath it is going to be flexor digitorum profundus. I'm going to go ahead and just pull it out to the side. And then right there, you can see flexor pollicus longus. And then if we go all the way to the deep, right, so I'm going to go ahead and move flexor digitorum superficialis out of the way. And then I'm going to move flexor digitorum profundus out of the way. And you can see this muscle that's going side to side, right? It's attaching on the ulna and the radius, right? That's going to be pronator quadratus right here. Okay. So now let's go ahead and just talk about a little bit of the functions that are associated with it. So if we go back to the top, right, we'll start with the one muscle on the anterior forearm that originates on the lateral aspect. So that's going to be brachioradialis again, right? Now notice when I pull on brachioradialis, the hand is kind of limp, right? It's not moving. So we can tell from that it's not crossing the wrist joint. So you won't get any kind of wrist movements associated with this muscle. So it's actually attaching on the styloid process of the radius. So because we said this is going to cross the elbow joint, right, because it's attaching from the lateral aspect, if you follow, come around this way, right, you can kind of follow, if we follow this one down, you can see it's attaching from the, starting at the lateral aspect, right? So once this contracts, you're going to have flexion of the forearm at the elbow, and that's pretty much it. That's the only movement that brachioradialis is going to do. Now let's look at the other muscles, right? We said if you fan out your fingers, you're going to have pronator teres, right? Flexor carpi radialis, and so on and so forth. So we'll look at pronator teres, right? Again, starts at the medial epicondyle of the humerus, crosses the elbow joint, so it's going to do flexion of the forearm at the elbow. And because it's coming across, and notice how it's attaching on the radius, which is seen right here underneath, once it pulls, it's going to pronate. And the function of this muscle is actually in the name itself as well, right? Pronator teres, so you're going to expect some kind of pronation. So again, it's going to do pronation of the forearm, and it's also going to do flexion of the forearm at the elbow. Next muscle we said right here, right? This is going to be flexor carpi radialis, right? And notice when I pull on this, compared to brachioradialis, you can see the hand wants to move, right? And that's because this is going to go out distally and it's going to attach on the head of the metatarsal, right? So because it crosses the wrist joint, we're going to see some kind of wrist action. So if you go back up here, right, we said it's going to originate from the medial epicondyle, so we're going to have flexion of the forearm at the elbow. Flexor carpi radialis is also going to cross the wrist joint, so it's going to do flexion of the hand at the wrist, right? And the other thing it's also going to do, because it's on the radial side, right, when you have flexion, it's going to do, it's not really well seen here, but it's going to do radial deviation, right? So it's going to look like this. So flexor carpi radialis. So these are all the functions, right? Flexion of the forearm at the elbow. We got flexion of the hand at the wrist. And then we also have radial deviation. Okay, going forward. Then we have this one right here. Right, notice this is going to be palmaris longus. That's going to start at the medial epicondyle of the humerus. So we're going to have flexion of the forearm at the elbow. And notice how I said earlier that this is going to attach on the palmar aponeurosis, this thin tissue right here, right? So what that's going to do is just going to tighten this soft tissue right here. So functionally, it's not going to do any kind of wrist movement. This is also a pretty variable muscle. A lot of people don't have it. I believe it's like 30% of the people will have it. So sometimes you can have it on one hand and the other hand might not even have it. Okay, so fanning across to the medial aspect. Remember we said this was flexor carpi ulnaris, right? Again, starting on the medial epicondyle of the humerus, you're going to have flexion of the forearm at the elbow. This is also going to be, it's pretty much same as flexor carpi radialis, right? They sound similar because this is going on the thumb side. This is called flexor carpi radialis. This is on the ulnar side, so flexor carpi ulnaris. So the functions are going to be pretty much the same. The only difference is going to be is that flexor carpi ulnaris is going to do ulnar deviation, right? So not just to like distinguish what the movements are, because the ulna runs this way, your pinky side. Any kind of movements going this way, we're going to call that ulnar deviation. And any kind of movements going towards the thumb side is going to be radial deviation, right? I don't know if you can kind of see that. Yeah, so if I tug on it, you can kind of see that the hand wants to deviate a little bit towards the ulnar side. So ulnar deviation. So again, flexion of the forearm at the elbow, flexion of the hand at the wrist, and ulnar deviation. That's going to be all flexor carpi ulnaris. Okay, so those were the superficial muscles. Now let's go ahead and take a look at some of the intermediate layer muscles, right? So we said here we have flexor digitorum superficialis. So flexor digitorum superficialis also is going to start at the medial epicondyle of the humerus, so it's going to do flexion of the forearm at the elbow. And notice how these tendons, right? Notice how these tendons are going to go to all these digits 2 through 4. And you can see a nice picture of that here, right? It's a shiny tendon that's going up, right? And remember I said flexor digitorum superficialis is going to go all the way to the middle phalanx, right? So because it crosses the wrist, you're going to have flexion of the hand at the wrist. Because it crosses the elbow joint, flexion of the forearm at the elbow. And so when you think about flexor digitorum superficialis, I want you to go ahead and make a fist, but don't make a complete fist, just like that. So your hands are still, the tips of your fingers are still straight, so that's going to be flexor digitorum superficialis, right? And then profundus, as we'll see, because we said that's going to attach all the way to the distal phalanx, it's going to help you do something like this, right? So when you go ahead and make a full fist, right, notice flexor digitorum superficialis, flexor digitorum profundus, because it attaches to the distal phalanx. So let's go ahead and see that again. Right, flexor digitorum superficialis, flexor digitorum profundus. Now remember I said this is the only, profundus is going to be not attaching to the medial epicondyle of the humerus. Instead, it's going to be attaching, fanning across both the radius and the ulna. And its distal attachment is going to be a little bit further up to the distal phalanx. right? And that's, so because of that, you're not getting any kind of movement at the elbow, right? So you're only getting flexion of the hand at the wrist, and you're gonna get some movements like this, right? Flexion of the very distal phalanx. And again, remember, just think about making a fist. If you go make a fist this way, this is gonna be flexor digitorum superficialis. When you go all the way, that's gonna be both flexor digitorum superficialis as well as profundus. Okay, the next one that we identified, so I'm going to take flexor digitorum superficialis and move it to the side. And then right here we can see this tendon, right? So that's going to be flexor pollicis longus, right? So if I pull on that, notice how the thumb wants to move, right? Right? So that is going to do flexion of the thumb. It's also because it crosses the wrist joint as well, right? You can see the tendon is going to cross the wrist joint. Because it crosses the wrist joint, it's also going to do some flexion of the hand at the wrist. And the very last one that we have is going to be, let's see, right, pronator quadratus. Now, pronator quadratus is going to be it's going to be a very powerful pronator. So it's going to do exactly what it says in the name. It's going to help with pronation, right? A lot of the times, pronator quadratus, in comparison to pronator teres is much more fatigable, meaning it'll get tired before pronator quadratus. In terms of function and identification, that's pretty much it for anterior forearm musculature. So what you want to remember in terms of function, right? Even if you can't derive what the names are, you can kind of see, are we on the anterior side or posterior side, right? When we're supinated, this is going to be all these muscles are going to be on the anterior side. If you kind of have a general idea of which joints they're crossing, you'll be able to tell which joints these movements are occurring in, right? If we're on the anterior side, the only thing you can have is some sort of flexion, right? Whether it's flexion of the forearm at the elbow, whether it's flexion of the hand at the wrist, or the flexion of the digits, right? So just kind of try and think about it that way. A lot of the times the names will give out what the functions are, right? So we talked about pronator teres, pronator quadratus. That's going to do pronation for the main part. And that's it.